Hi everybody, it's Kayla again. I just kind of wanted to talk about my first week of nursing school for this second semester. I just finished it on Friday and I started my second week today. So just kind of wanted to go over everything that we've had to do so far and what I have experienced, I guess. So first things first, I had to go and buy 3 more books. I had 2 of the other 5 because I bought my books from a previous student, so I didn't want to go and get more for no reason or to buy the same book again, of course, right? And it just helped me save a little bit of money for myself. That being said, we haven't used any of them yet, except for today. We used the maternal child one today. Last week, started out the first day, they kind of went over everything that we are going to be doing over the semester, mostly with clinical stuff and what we need to do for that. For my clinical, I am doing med-surg first and then maternity with 3 weeks in between doing outpatient work. So that will be unique. I wanted maternity to be after. It was kind of like, for me, people always say eat your dessert first because you never know if you're going to have time. I like to eat my dessert last because I like the flavoring to stay longer, or the taste of it. I don't want to have the last thing that I put in my mouth be, green beans. I'd rather have the ice cream and remember that as my meal. So kind of the same thing with maternity. I love maternity. I don't know if I love the nursing aspects, but I do labor and delivery photos, so I wanted that to be last so that I could make sure that this past semester would leave a really good feeling with me. Not saying that med-surg doesn't, but I've never been there, so I don't know yet. That could be better than maternity for me. I just simply haven't done it yet. After we did that, we started writing and lecturing on the first day. And then the second day was more lecturing. And then we had a skills exam. Not a skills exam, but like a health assessment that we had to perform on. I got a lovely older lady. She's not super old, but she's older than me by at least 26 years, give or take. I had her perform it on me first, and then I performed it on her. And it's mostly doing a head-to-toe assessment and seeing if we can remember everything and document and do tests and whatnot on them. So, vision tests, hearing tests, motor function, skin integrity, and so on and so forth. Then we had a quiz over it that we had to do this past weekend. I did not do so well as I thought it would be. So it could have been a lot worse, I guess. But not a good way to start out the semester, even though I really wanted to knock it out of the park. The second exam, or technically second quiz I had, was today over medications. And it's one of the ones that you need to get a high enough grade or they get concerned. So for us, they told us we want you to have at least an 80, and if you don't have an 80, then you need to come see us immediately. And it's not that you're going to be kicked out for that medication exam, but they want to know that you can comprehend how to do it. And a lot of it was calculations. Not a big deal. I'm really good at math. And some of the questions were really easy compared to what we have been through. So one of the questions I remember was, a patient needs to take 600 milligrams of ibuprofen for today. How many tabs is it if a tab is 200? It's going to be 3 tabs. So it was simple things like that. Or he gave a list of medications. One was oxycodone, and the question was, what medication in this list is one that you'd be concerned about constipation with? Narcotics cause constipation. So that right there was my answer, and the rest of them were like ibuprofen. I think insulin was another one, and then there was another Chi, maybe a statin. I'm not quite sure. I didn't pay attention to all the other answers for every question. So it's been pretty easy so far, and I start my clinicals this week, so I'm gonna try to make sure that I show you guys a video about my first clinical week. We have 2 days for every week for this semester, so it's gonna be a little bit more hands-on and less learning for lecture-wise, which is fine. That's cool, So I'm hoping it's gonna go well, and I'm hoping to impress my instructor and try to recall every information, because I did not study as much as I should have during the break, and I am realizing that. So do study. Make sure you do it during your break because you will forget information that you learned. So anyways, guys, that was my first week. It was just a couple of tests, reviews, and we also had simulations that we had to do on Friday, which I had to do 3 of them. Everybody did. And it's basically, 4 or 5 roles, and everybody has to do one. Student nurses, LPN, RN, or respiratory or family member, and you had to play that role. And like for me, my first one is I had to give heparin. I had to check patency of IVs. I did a lot of IV sims for that one, and IVs I'm fine with, especially with the machine. It makes it so much easier. But I can do gravity drip too, but those ones are less accurate than the machine, unfortunately. So I had to give a lot of medication, insulin, draw blood sugar, not draw blood sugar, but check glucose, scan, and do a insulin injection. So I do primary nurse, and I had 2 assessments, but priority ones, and one of them I found crackles in the lung, which means somebody probably has pneumonia. It's been a fun time. So anyways, guys, that is it for this week, I guess. And like I said, I'm going to try to make one at the end of this week when I do my clinical days. If you have any questions or you want to know more about what I'm doing to myself or so on and so forth, whatever, ask me. So anyways, guys, keep on nursing.